I'm a little bit afraid to give the talk now after that introduction. I may muck it up or something. Well, I don't have time to waste because this was the most difficult presentation I had ever put together. And I didn't realize how daunting the task would be, but hopefully you enjoy it. I enjoyed putting it together. You see the title, War and its Influence on Innovation in Medicine and Cardiac Surgery specifically. I have no declarations. War and medicine is very interesting in that it brings about innovation purely due to circumstances that only occur in war. And the innovative contributions would eventually have probably evolved in clinical practice in the civilian world, but war hastens that process of innovation purely due to medical and humanitarian commitment to the wounded soldier. Some of the facts that you may not be aware of in researching how many wars had been conducted in the history of humanity, about 14,025 as of the war in Ukraine today. And the bloodiest war in history, of course, was World War II, 70 million fatalities. And that's the combination of civilian collateral damage plus the death of the soldiers. And you may find it interesting to note that over the past 3,400 years, humans have been at peace 268 years. That just blew my socks away, or 8% of the time. And that's in recorded history, and up to 1 billion lives have been lost. Yet there's no genetic basis for war. And I can't belabor that point because I have limited time, but don't that just astonish you? The Iliad is probably the first place to begin in the genesis of military and combat traumatology. It reported 141 wounds and 150 anatomic terms were stated by Homer. And if you look at the Iliad at close examination, it's the first written data on the heart and examination of the heart. Idomeneus had been stabbed in the chest, and to make a long story short, the spear in his heart was struck fast, but the heart was panting still and beating to shake the butt end of the spear. And that's at the point at which he died. And I don't think there's an earlier written recording on the heart than this. And it was depressing to me when I first started challenging myself to put this together. I was thinking of John Lennon's Give Peace a Chance and stuff like this, you know. It's impossible in humans, I guess. And Heraclitus is the philosopher who wrote that war is the father of all things, war is the king of all. And so if you fast forward from the ancient Greeks to Galen around probably 56 to 65 AD, he was among the earliest writers on reporting combat injuries. And another figure, Ambrose Paré, was very sentinel in this period near the beginning of the Renaissance. He utilized ligatures to tie off arterial injuries and became very well respected for his methods for treating the wounded soldier. Two sentinel figures in the Renaissance were Petit and Dassault. The development of a tourniquet, which is used profoundly today in military medicine to control hemorrhage and minimize blood loss as much as possible. And then Dassault, he was a trained military surgeon who developed diagnosis and treatments for war wounds. And he became very prominent and respected in that he trained military surgeons in this methodology and educated them. So beginning with the Revolutionary War to the Mexican-American War, you can see the contributions that France made to the effort in the Revolutionary War, and it was magnificent. And if you set the tone for the Revolutionary era, I think Tolstoy's War and Peace stated it best. Though the doctors treated him, let his blood, and gave him medications to drink, he nevertheless recovered. And that's about how depressing medicine was in the Revolutionary era. We were 100 years behind Europe when that war was launched. And you see some of the conditions that the military survived in or not. Filth was just everywhere. And so you can imagine the microbial world had a field day when it came to invading the wounded soldiers. And anesthesia in this period was ice and salt. And the most sentinel innovation would have been George Washington's orders to in 1777, ordering all soldiers be inoculated for smallpox. And it was a game-changing decision that he made. And then to zoom in on the conditions during the Revolutionary War, the British Army noted that hospitals were more dangerous than the battlefield. They lost 4,000 men to battle and 40,000 to infectious disease. Innovation really kickstarts and commences in the Napoleonic Wars, which were wars between the French and other European nations and so on and so forth. Social, economic, and other reasons drove those. There's no figure in trauma medicine more sentinel than Dominique Larrey. He developed just about everything we use today, which included sanitation, safe sanitation practice, epidemiology, evacuation of the injured from the battlefield, and training of medical personnel. And interestingly, he operated on 1,200 soldiers in the abdomen and only lost 45. He developed what he called the flying ambulance. And this gave what the military calls today the golden hour, for which when a soldier is wounded in the maximal possibility to save that wounded soldier is in that golden hour. And he probably should be credited with originating that. They used to have to wait until the battle was over to then recover the wounded. He gave the first description of triage. He conducted the second pericardial centesis in 1810 and ligated the femoral artery and utilized positive pressure ventilation for soldiers wounded in the chest who had the need and requirement for drainage. This is to set the record straight. You know, there was a lot of debate on who was the first heart surgeon, this, that, and the other. And research proved that Francisco Romero in 1801 had performed the first pericardial centesis, and the other gentlemen you see listed here followed. A sentinel point occurred for all of us relative to artificial circulation. Lee Galois published his works, and to set the tone for his research, he was conducting research with the idea of the decapitations that were taking place in the French Revolution. And he utilized that observation to propose his idea for artificially supporting the human heart. I'll let you read the quotation there. Many of us are familiar with it, but he published this in 1812. He thought the heartbeat was neurogenic in its generation, and yet Gaskell proved in later years that the heart was myogenic in the generation of its heartbeat. This is an interesting case right here because in 1809 in Kentucky, rural Kentucky, Ephraim McDowell conducted the very first laparotomy, and he did so under the threat of a posse of men seated outside, waiting to see how Miss Crawford survived or not the operation that he engaged in. He removed a 22.5 pound ovarian cancer from this lady, and she survived 32 years. He went on to perform surgery on James K. Polk before he ever became president. And 32 years later, I think it was, 32 years later, Polk became president after the operation was conducted. And so it would be another 144 years before the abdominal aortic aneurysm repair by Dubose would be published. And it always interests me. I've presented here before on some of these history things. The kitchen table in the world is very prominent for the birth of cardiac surgery. You see that here in the image that represents his procedure in 1809. Luther Hill used the kitchen table in 1902 to conduct the very first open heart repair in America in Montgomery, Alabama area. And then Alexis Carrel did direct blood transfusion on his daughter, who was strapped to an ironing board. And the father was placed on the kitchen table in New York City to conduct direct blood transfusion. So if you are not familiar with those stories and those people, I would encourage you to become investigative and research on them. It's amazing what they did. Then the most sentinel innovation moving forward, Spallanzani described echolocation as to how bats fly when blindfolded and navigate without any problem. And of course, this enhanced the research and prompted research by Collidan and Sturm to develop their investigations into the speed of sound in water, which they found to be greater than the speed in air. And then the event of the sinking of the Titanic spurred the development of the hydrophone to be able to locate icebergs as a result of that pitiful day. And then in 1917, when World War I was launched, they used sonar sound in the submarine vessels. And the first medical use of fast forwarding through that research period, Dusick became the first person to use ultrasound. He was researching the changes in the ventricle of the brain relative to brain tumors. And then Edler and Hertz made things possible to utilize ultrasound, as we see every day with the use of TEE now. And that's been a monumental step in cardiac surgery. So we move now to the periods you see here, which were pretty amazing periods, from the Mexican-American War to the Spanish-American. Anesthetics were used for the first time in a combat situation during the Mexican-American War. William Morton had published his work on ether anesthesia, and it was rapidly embraced by many physicians, and they utilized this in that war, in that period, which led to the Republic of Texas being product, which I'm very proud of. But the damage that they could do with the bladed weaponry and the high caliber rifles, it was just devastating. And unfortunately for soldiers in that period, most of the outcome was amputation. In the Crimean War, this war was the first war in which they utilized modern technologies such as explosive naval shells, railways, and telegraphs. That is very Sentinel building from sonar sound into what you'll see in a minute. The war was also one of the first to be documented, very detailed, and photographed. And no figure looms larger in that war than Florence Nightingale. It may seem a strange principle, she stated, to enunciate as the very requirement in a hospital that it should do no harm to the sick. And we all say amen to that. And you can see the changes they innovated in the ambulance. It was pulled by 6 mules and could house 10 wounded soldiers. And that's awesome, getting that many people back to the field hospital as rapidly as possible. The British disease rate was so dismal, they had 60,000 troops in the field, 21,000 died. Here again, the microbial world, battle injury and death was only in 4,500 soldiers. 16,500 died from disease. This was a Sentinel development that occurred with Florence Nightingale's work on environmental medicine and public health. Life expectancy increased from age 39 in England to 55 by 1910. And around 1910, America was still, if you survived to age 10, you were likely to live to 47 years of age. So we were lagging a little behind on that. And her legacy was not just her nursing conduct in the war, but yet she made nursing a science, and it became a profession. And everybody knows today that we celebrate International Nursing Day on May the 12th each year. Now, moving into the Civil War, this may be of interest to you. That's a photograph of William Morton and administering anesthesia in 1846. And the success of that event was just amazing. Surgery became a safer practice, and it wasn't the misery and trauma or inhumane type event that most people experience. And prior to that event, they could only perform one surgical procedure a week at Mass General. This is an interesting story right here. I want you to store it in your mind for a very near future statement that I'm going to make. This gentleman, Mr. Miller, had been shot in the head. He was a Union soldier who fell, and the Confederate forces overtook the area. He was furloughed home 9 months after incurring the wound, and he had his doctors attempt to remove the fragment from his head. They took out the musket ball. 17 years later, after I was wounded, a buckshot dropped out of my wound. And 31 years later, 2 pieces of lead came out of the wound. Can you imagine that? Now, this is a very important event that took place. To our knowledge, there's about 13 African-American physicians that assisted with the wounded in the Civil War. And boy, they were highly contributory. And to read on these people is a lesson that we all need to place in our mind and heart. Charles Purvis was the first African-American doctor to treat a sitting U.S. president when James Garfield was shot, and ultimately he was assassinated by Charles Guiteau in 1881. And then James Smith became the first enslaved-born citizen in New York City to set up a medical practice. And just remember, all these gentlemen had to go abroad or to Canada to get their education, because the lovely period in that era, due to their race and so on and so forth, they couldn't get the education here. And that's sad. But he went on to develop a thriving medical practice in 1837 and operated the first Black-owned pharmacy and authored the first published African-American case report. So these gentlemen were very sentinel. I could do a whole presentation on them. Another female figure, women were not as prominent in this period in the Victorian era. Nursing was not considered a woman's job. And yet Clara Barton was just as fiery and feisty as Florence Nightingale. And she took it upon herself to engage in taking care of the wounded. And after the war, she went on to assist families in locating their deceased loved ones who fell to death in the war. So she's a very sentinel figure. These women were prominent. All were born into slavery. But Susie King Taylor was the first Black nurse during the Civil War, and she went on to contribute very highly along with others. There were about 3,000 nurses in the Civil War that were of African-American descent. And then the badge of honor, I don't know today what to say about this, but yet Sally Tompkins was the angel of the Confederacy, where Florence Nightingale was the angel of Crimea. That probably isn't a badge we really admire, but yet to take care of the Confederate Army, she was the first woman to be commissioned into the Confederate Army and the first woman in American history to be formally inducted in the military. And then it really surprised me when I found Harriet Tubman. She was famous for the Underground Railroad and attempting to get people into freedom and enjoy life. And she nursed in the Civil War herself and saved many of the wounded soldiers for the Union. War advances consist primarily of ambulances, stretcher bearers, systems of triage, and then hospitals in this period became places of healing rather than places to go and die. And the nursing profession emerged as a great contribution from this war. Now, back to telegraphs, electricity, and medicine, and so on and so forth. Augustus Waller and Wilhelmine Thoven developed electrocardiography based on the innovative activity that took place in the Civil War era and Crimean War. And the rest is history with regard to the statements and contributions that these two men made. So the Spanish-American War still battled the same old microbial problems that the wounded soldiers experienced. The war was with the United States and Spain and was very brief. Its results were many, startling, and of worldwide meaning. They forged a victory, and this is the first war in American history where former slave holders and former slaves themselves fought united side by side in an integrated effort. They shared food and drink as well as peril and discomfort. And it saddens me to think that I grew up in an era when I remember going to the physician's office and There would be a black waiting room and a white waiting room. And I'm so glad we're beyond that for humanity's purposes. These examples of this war are lessons we still need to learn today. Intraoperative blood salvage emerged in the period around 1818 with Blundell, but his success was non-existent. It wasn't until 1886, around the period of the Spanish-American War, that era, that John Duncan transfused blood, filtered through a cheesecloth, I believe it was, and he was able to demonstrate that you could save auto salvage blood. Terry, did you ever see that Bentley auto transfusion device? You did? I don't believe I saw that one. I remember my first introduction was when Hemonetics came out with their unit. You used that. It don't surprise me. Here is a major contribution to medicine and science. Wilhelm Röntgen developed the world's gift of radiology. And he took an x-ray of his wife's hand. That's, you see the ring on the ring finger there. It had to be immobilized and stationary for 15 minutes for his device to produce that image. And the Spanish-American War was the first war where radiology and x-ray was utilized to diagnose and treat wounded soldiers. And then this led to many things that I'm going to introduce to you quickly. Seldinger, everybody's familiar with the Seldinger technique, but Sven Seldinger wrote that he had a severe attack of common sense. He had 3 objects in his hand, and he was unsuccessful with his first attempt because the order was not sorted out. He took, you can read right here, he took the sentinel moment that occurred to him was needle in, wire in, needle off, catheter on, wire, catheter in, catheter advance, and wire off. And that was the proper order. And we see that applied every day in the cath lab and Swan-Ganz insertions and even radiology. I mean sonar technology, inserting radio artery catheters. This is a very busy slide as well. It should be. And I'm not going to tell the stories of all of these men, but these names are people that you should research and become familiar with. The one that's the most incredible is Werner Forsman. He stuck a urethral catheter into his brachial, in the cephalic vein, I believe, well, brachiocephalic vein, advanced it into the right ventricle, walked down to the radiology department and shot a chest x-ray showing that catheter in place. You see him looking at the x-ray with the nurse there. That was the first introduction of a catheter into the heart. And all these other gentlemen, from Judkins to Soames and Dotter and Fogarty, you see that every day, the gifts they've given us. And then Cribier introducing TAVR to the world is a monumental step. Read on these guys and become intrigued. Finlay was very prominent in developing, there's no cure for yellow fever, but yet 1 in 5 people that get infected with it die. And he came up with all the proposed treatment, identified the mosquito as the vector. And of course, everybody rejected his thoughts, but eventually it took 20 years for them to be embraced, and the rest is history in that regard. The blood groups were identified and discovered by Landsteiner in 1900. And in 21, Unger developed the RH factor and made blood transfusion safe. Entering into the war to end all wars, there's no statement more prominent than Sir William Osler's statement, strange that man who dominates nature has so far departed from nature as to be the only animal to wage relentless war on his own species. And he lost his only son in the battles in World War I. The advancements that took place here were many. It was the first war fought in human history conducted on land, air, and sea. And then electricity was on everything, ranging from ships, planes, vehicles, tanks, and more. And trench warfare was established in World War I, and it was pitiful for the conditions. The soldiers were for days and weeks in a trench fighting the war, and with no change of socks, no change of shoes or anything like that. And it proved to be abysmal. And you look at the sketch of the rat there, and hopefully y'all can go back and look at this. Walt Disney made that sketch. Here's an image of Alexis Carrel and Alexander Fleming, along with Henry Dockin. They developed a irrigation solution, which Fleming, who went on to develop the discovery of penicillin, identified the fact that those irrigation solutions were doing more harm than good to the wound. And it may become a surprise to you to know that Ernest Hemingway, Walt Disney, and Ray Kroc, who founded McDonald's, they were too young to fight in the war, but they were committed to the war effort. So they volunteered to the ambulance corps, and you can see motorized ambulances emerged in the period of the World War I. And the rest is history, what these gentlemen contributed to the world. The very first attempt to remove a bullet from the heart took place by George Gray Turner in 1917 in World War I. He was not successful at removing it because he identified the fact that the projectile was embedded in the ventricular septum. Therefore, he abandoned the procedure because in that period, you had no pacemaker, you had no defibrillator, and the gentleman went on to live another 25 years with that in his ventricular septum. Charles Drew became the father of blood banking. He was the monumental figure who made blood transfusions safe. And that was the major gift of World War I think. And Walter Cannon developed the methods and protocols for treating traumatic shock. And you can see him pictured with the large arrow on the top of the image. They have a circle around Walter Cannon. And then the gentleman on the very front row with a yellow arrow is Harvey Cushing, the father of neurosurgery. And it blew my socks when I read this story. Harvey Cushing and Mass General sent a team of Harvard doctors to Europe for the treatment of the wounded soldiers. He had about a 6 to 8 inch stainless steel nail that he sterilized. Anyone shot in the head, remember the guy from the Civil War, he advanced the nail through the path or tunnel that the bullet made, traversing to the inner brain. He advanced that nail down to the metal fragment, and the great Elliot Cutler, who was assisting him, would apply a magnet to the other end of the nail, and they would pull the projectile out. And that's in World War I. And there were no innovative tools or instruments to conduct that otherwise. World War II, the War Department sent out this statement. In the last war, we brought the wounded to the hospital. In this war, we are bringing the hospital to the wounded. And there's no figure larger than Elliot Cutler. He did the first mitral valve repair in 1923 at Harvard. And then he became a member of the team, as I just stated to you, working with Harvey Cushing. He was amazing. He had ordered 50 billion units of penicillin for the war effort. but yet breaks in the weather moved the date for D-Day invasion very quickly to June the 6th, 1944. He only had 600 million units. And if you notice in the captions down below, the wounded soldiers in Italy, where there was not adequate amount of penicillin, did not have the outcomes that the D-Day invasion at Normandy had. That's pretty amazing. And here's some images of how they prepared for the war, getting ready to conduct the invasion. And you see the various forms of transportation and blood supply. And here is a slide. If you can go back and look at this, you see the monumental effort that took place on that one day to liberate France and eventually the European countries that had been taken by Hitler. This man is my hero, Dwight Harkin. He was 34 years old. He was embedded in Stowell Park in England so that they could evacuate the wounded soldiers to his operating theater, which you're not going to believe in a moment, and then the field hospital that he was in charge of. And you see this image of the wounds that he removed from the great vessels and the heart itself. 135 projectiles removed, 78 in the great vessels, 56 in the heart, and not a single soldier died, which was incredible. He proved you could operate on the heart and the heart would survive. It's basically his gift to medicine. And I think he's amazing. His son, Alden Harkin, is a cardiac surgeon too. I'm not sure if he still practices. And you see the map here. I tried to draw an arrow. You can't see it in the back of the room, but where Stowell Park was located in England. And look at the operating theater. It was a Nissen hut, and he would do the surgery. I can't imagine the poor lighting. And then they would transfer the patient out to the field hospital. And he's actually one of the first people Dr. Cooley inducted into the Cooley Society and awarded him the Ray C. Fish, I believe it's Ray C. Fish Award. Dwight Harkin was very amazing. And you can't talk about the greatness of others and not mention the name Michael DeBakey. He was in charge of the medical corps in World War II. And he, along with Simeon, investigated the condition of the soldiers at the point of their first examination. And he concluded 60% of their normal hemoglobin had been lost, 40% of their normal blood volume. That would be frightening. But DeBakey is pictured here receiving the Legion of Merit Award. So if you look at contributions, these are Sentinel contributions that had developed that made World War II improving upon the ability to care for the wounded soldiers. And I was surprised to learn Robert Shaw, who was a surgeon in Dallas, a thoracic surgeon. He was to thoracic surgery what Dr. Cooley was to heart surgery. And boy, he was an amazing man. And you did not counter Dr. Shaw on anything. He was an eloquent speaker, and he developed double lumen tubes that we use today. There were others that had been developed, but he operated on John Conley when Kennedy was assassinated in Dallas in 1963. Here's the Korean War, and I'm going to wrap up so you can all wake up now. You see the use of helicopters evacuating. This was the birth of MASH units, which was a contribution of Dr. DeBakey. you know, they cut the death rate in half by utilizing MASH units and air evacuation. This gives you a little insight into the MASH staff and the image on the upper left, and then the operating conditions on the lower image. And some of the remarkable things they did was develop the use of artificial kidneys. Willem Koff is responsible for that. And then the anticoagulant heparin was utilized, and other methods to treat and save the wounded soldier. This is an interesting topic that Terry probably knows more about than I do, but being an engineer, phthalate is used to soften PVC from IV tubing to blood storage bags. And the transition coming out of the Korean War was blood bags were plastic, not glass. And I remember prominently, we would have anesthesiologists say, hey, can you get me a bottle of blood, you know? And that was a reference to their past. I remember using bottles as late as the mid-70s. And the problem with them, you drop them, they break. But phthalate is becoming investigated now for the risk that takes place utilizing it. The chemical leaches out into the blood that's stored inside it, and about 12% of it appears in the bloodstream. And the heart-lung machine gets blamed for a whole lot in terms of inflammatory mediation. This information just came out in 2017 in England. So I think that's something we need to keep our eye on. Now, the Vietnam War to the present wars, you could once again do a whole presentation on this, but their greatest gift is utilizing ECMO. The world's longest ECMO transport, and Kathy did a shift last night. They transported a patient that was on ECMO in Afghanistan, flew to Germany, flew to San Antonio, Texas, to the air base there on ECMO. And those surgeons presented at a meeting at the academy that I chaired. I think it was in 2014, they had done that ECMO transport. But you see the contributions, and there's so many. I wish Dr. Fraser was here, Bud Fraser. He was in the military in the Vietnam era. He could tell you more about what they did and innovated than I could. So I'm done. I want to thank you, and I want to say thank you to anyone in this room or on the webcast who served in the military or is actively serving today. God bless you all, and thank you.